Sensory motor amnesia is not diagnosable by a medical doctor or the medical system. If your symptoms stem from sensory motor amnesia, deeply habituated patterns of chronically stuck muscles and tension in the nervous system and brain, your doctor will not be able to diagnose this. Medical doctors, unless they have learned otherwise, have no training in somatics nor the extent to which common symptoms can be caused by sensory motor amnesia. Think of sensory motor amnesia as deep, strong, habituated contractions of muscles and chains of muscles that clamp down on organs, tissues, joints, limiting mobility, decreasing circulation, impinging nerves, and limiting essential processes like breathing and digestion. If you suffer from chronic back pain, TMJ, plantar fasciitis, jaw pain, tight hamstrings, frozen shoulder, IBS, constipation, sciatica, bulge discs, carpal tunnel syndrome, tightness in the chest, and many more common diagnoses, sensory motor amnesia may be the cause. Subscribe to our channel so you don't miss out on our latest videos, where you will learn practices to re-educate your muscles using your brain and release the symptoms that reflect habituated tension patterns in your body and mind. We encourage you to join our community and learn with us. Sensory motor amnesia, or SMA, is the somatic term used to explain the brain's loss of voluntary control and sensory awareness of muscles in the body. Essentially, we have no idea how tight and stuck we really are. Our brain holds us in patterns in response to stress, trauma, repetitive movements or thoughts, emotional burdens, and even injuries. Sensory motor amnesia shows up in many ways, most often with persistent and unexplained body and muscle pain from involuntarily contracted muscles that no amount of massage or stretching changes. Whatever the source, chronically contracted muscles will distort your posture and movements, and as a result, the following 5 things may result. Number 1, you have overworked muscles that become sore and painful. Number 2, certain muscles become weak due to constant exertion, and people may complain of general fatigue. Number 3, the overall synergy of the body and coordination becomes impaired. So people are more likely to have falls, to generally be more clumsy, and they may emotionally express more fear of such daily activities such as walking, going up and down stairs, and making travel plans. Number 4, when some muscles around a joint become chronically contracted, the joint cannot function in an organized way. The joint is no longer positioned for efficient use and movement, and this causes friction within the joint, leading to arthritis and other conditions. Number 5, posture becomes imbalanced and distorted. Weight distribution problems add to muscle and joint dysfunction. So for example, if a person is leaning to one side because they have chronically tight waist muscles, usually the hip, knee, and ankle joints on that side will carry a disproportionate amount of weight, further distressing function and pain levels. The good news is that if sensory motor amnesia can be learned, it can also be unlearned. The brain can be trained using a technique called pandiculation. Click the banner below to download our free ebook, where you will start learning how to address what's showing up in your body as a result of SMA. We have a really amazing 6-week Change Your Pain Starter program that will teach you all about how to use pandiculations to address SMA in your body. I'll put the link below this video. If you like this video, please click like, please subscribe to our channel, and thanks for watching.